More than 1.1 million people are about to lose their current Medicare Advantage plan, and most of them have no idea it is coming. Medicare Advantage, in plain English, is the private company alternative to original Medicare that bundles your hospital care, your medical care, and usually your prescription drugs into one plan. And the change takes effect January 1st, 2027. Why is one date getting so much attention? Because January 1st, 2027 is the day these plan terminations officially take effect. There is no extension and no grace period. Just a new year with a missing plan, 1.1 million people, one single date. And here's the uncomfortable part. Your plan might be one of them. You can love your coverage, you can have the perfect doctor, you can have zero complaints, and your plan can still vanish. Because the company, not you, is the one walking away. That is exactly why this video exists. So in the next 7 minutes, I'm going to show you exactly who is cutting plans, what is happening to drug premiums in 2027, what is not changing, and the 3 moves that fully protect you. And no, you do not need to become a Medicare expert to do it. This is very fixable. You have a 54-day enrollment window. Let's go first. The WHO, UnitedHealthcare, one of the biggest health insurers in the country, is exiting Medicare Advantage plans that cover more than 600,000 people for 2027. This is the largest single wave of plan exits heading into the new year. Every single one of those members now has to find replacement coverage before January, and UnitedHealthcare is not acting alone. Humana, the other giant in this market, is dropping about 600,000 members of its own. Put those two together and you're already past 1.1 million people forced back into the shopping aisle through no fault of their own, and it might not stop there. UnitedHealthcare is also considering pulling out of 34 counties across 12 states, which would take coverage away from at least 20,000 more people. If your county is on that list, your options could shrink again. Those decisions are still being finalized, so keep an eye out for updates this fall. Now let's talk about scale, because this is not some fringe corner of Medicare. More than 35 million people are enrolled in Medicare Advantage, and that is more than half of the roughly 68 million Americans on Medicare. In other words, the private plan route stopped being the alternative a long time ago. It is the main road. Okay, deep breath, because here comes the most reassuring number in this entire story. Something like this already happened, and it was bigger. At the end of 2025, 2.6 million beneficiaries had their plans terminate. That is more than double the number being affected this time. The sky did not fall then, and it is not falling now. So what actually happened to those 2.6 million people? The health research group KFF checked, and 98.9% of them still had at least one Medicare Advantage option available where they lived for 2026. Plans disappear all the time in this program. Coverage options almost never do. Next shift, and this one touches your drug costs. Part D, quick definition, is the prescription drug part of Medicare. For 2027, the administration is ending a subsidy program that has been paying Part D plans to keep your premiums stable. Stable is the key word in that sentence. So how much did that program actually matter? The average Part D premium in 2026 is about $36 a month. $36 for millions of people. That is the difference between a quiet budget and a squeezed one. And that number has been held down in part by exactly these subsidies. Take the subsidies away, and KFF warns that some standalone drug plan premiums could rise more than usual for 2027. Notice the wording there, could. Final numbers do not exist yet, because CMS releases the official 2027 plan premiums in mid to late September. Until then, treat every specific premium number you see online as a guess. Now, the single most important correction floating around the internet. Extra Help, the federal program that pays drug plan costs for people with limited income and resources, is not ending. Read that twice. Extra Help continues in 2027 and beyond. Some headlines are fusing 2 separate stories into one scary headline, and that is causing real confusion. Could you potentially qualify? The rough guide is income below about $22,590 if you're single, or below $30,660 if you're married, along with limited resources. Those limits shift a little each year. So treat them as ballpark figures, not a wall. The check takes minutes, and it can save you thousands of dollars a year. Now let's flip the script, because a lot is not changing. The out-of-pocket cap on Part D drug costs stays in place. A cap just means there's a ceiling on what you can be asked to spend in a year. It rises from $2,100 to about $2,400 in 2027, but the protection itself is written into law, not into a subsidy. The Part D deductible stays around $700, and insulin stays capped at $35 a month. Those are locked-in protections, not budget line items that come and go with the political cycle. The negotiated drug prices keep going too. Medicare's drug price negotiation program continues for 2027, and every negotiated price rolls forward automatically. If you take a negotiated drug, those savings follow you into the new year. So between the cap, the deductible, and the negotiated prices, the foundation under you is holding. So here's your action plan. Move number 1. Watch your mailbox for the annual Notice of Change letter, which must arrive by the end of September. If your plan is terminating or your costs are jumping, that letter is your official warning. Do not toss it in the junk pile with the catalogs. Move number 2. Compare plans during open enrollment, which runs October 15th through December 7th. Use the official Medicare plan finder at medicare.gov. Enter your medications and then confirm your doctors and your pharmacy are still in network before you switch. Whatever you do, never just auto-enroll into whatever plan you get assigned. The auto-enroll path is the single easiest way to lose access to your own doctor. And remember, you have 2 paths, not 1. Either pick a new Medicare Advantage plan or drop back to original Medicare and add a standalone Part D drug plan. Both paths are legitimate, and the right one depends on your doctors, your drugs, and your budget. You have 54 days in that enrollment window to get this right, which is plenty of time if you start on schedule. Move number 3. Check whether you qualify for extra help, even if you assume you do not. Millions of people who are eligible for that program never apply, and those savings disappear if nobody claims them. It costs nothing to check, and it might be the easiest money in this whole video. Bottom line time, yes, 1.1 million plans are disappearing, and yes, drug premiums have real pressure on them. But 98.9% of people who lived through a bigger wave last year still found coverage, and you get a 54-day window to do exactly the same thing. If this video helped, subscribe to InsurNerd because we explain insurance without the jargon every Monday, Wednesday, and Friday. Disclaimer, this video is for educational purposes only and does not constitute financial or insurance advice. Always consult with a licensed insurance professional before making decisions about your coverage.